Thank you so much. Yalek and Dr. Joe are very tough acts to follow. I've been treating myeloma patients for a very long time, and I still learn something new every time I hear them speak. So, good morning. As Dr. Joe said, my name is Pierre. I'm a nurse practitioner at Memorial Sloan Kettering. I am a senior clinical director at Flatiron Health, and I'm a member of the Nurse Leadership Board for the IMF. And today I'm going to talk to you a little bit about myeloma, of course, and really how to communicate with your healthcare team and how to empower you to really advocate for yourself and your family and ask the questions and play a dynamic role in your care. All right, so of all the topics that we covered today, I want you to remember one thing. First and foremost is that you can really change the course of your care by actively participating in your healthcare. So we're going to talk about the best ways to communicate with your team today. And the best way to start is with effective communication is knowledge, right? You're here today, you're learning about myeloma, you're learning about the risk factors. And so once you understand that, you can start to understand the signs and symptoms of the disease. And then you can speak with your healthcare team to sort of understand what your risks are, and then maybe pursue screening to see if this is something that you actually have, or even encourage your family members to talk to their healthcare team about as well. Spread the knowledge. We're only talking to select folks today, so everything that you learned today, please go home and tell your family, tell your friends, so we can continue to spread the information about myeloma. So for the management of myeloma, we really utilize a two-pronged approach. So we treat the myeloma itself, and we provide supportive therapies to help tackle the treatment from the myeloma and the myeloma that can cause some side effects. And so the purpose of treatment is really, like Dr. Joe said, to bring down the level of that myeloma burden so low so you can have a durable and deep remission. And that's to really improve overall survival, minimize side effects, and we want to have rapid and effective disease control. And not only will that improve overall survival, it will also improve quality of life for patients as well. All right, I love doing these programs because we always have the patient at the center and then everybody else sort of in the periphery. And as Dr. Joe said, it takes a village to take care of a myeloma patient. So who are all these people? You're going to have a lot of people involved in your care, so it's very important to keep a list of all your providers, their contact information, because one provider may want to communicate with the other provider and sort of talk about your care and make sure it's individualized. So to take charge of your care, know who your healthcare team is. Sometimes you might have a general oncologist who's taking care of you, or a myeloma specialist, or sometimes both. It's really important to have a myeloma specialist involved in your care, either as a second opinion or even someone who might just have a high volume of myeloma patients, because literature does show that patients who are taken care of by a myeloma specialist live longer. So it's very important to have these people in your care, and as Yalek said, please reach out to him to find out if there's a specialist in your area who can take care of you and be a part of your team. And so don't forget your primary care physician. I know patients start to get appointment fatigue, and the primary care physician is sort of the first one on the chopping block that they stop seeing. Your primary care physician is very, very important. They really take care of you from head to toe. We're laser focused on your myeloma. They're monitoring your blood pressure, your cholesterol levels, your glucose levels. They're making sure you're doing all your screenings for your mammograms, your colonoscopies, your PSA checks, because we're really looking at your myeloma. They're sort of the umbrella, and they're looking at you from head to toe. And then also we have other people in your healthcare team, such as your nurses, nurse practitioners who work closely with your oncologist in a collaborative effort. And then you also might have other healthcare members, right? Ask who they are. You might have a research nurse, an infusion nurse, an office practice nurse, the nutritionist, the pharmacist, radiation oncologist. There's a lot of people who are going to be involved in your care. And of course, your family and your support network. Have them involved. If you can, bring them to your appointment so they can be your second set of eyes and ears, and maybe ask questions that you haven't even thought of. All right, so shared decision making, how to take charge of your care. So once you have a good understanding of who's on your team and their role, you can really begin to formulate the appropriate questions to ask, right? And so your visit with your team really should not be one-sided. It should be a two-way street, a conversation. You shouldn't just be listening and taking it all in. You should be asking questions as well for deeper and further understanding. And you should always come to an agreement, right? To revisit decisions, not a one-time decision. Sometimes you can revisit decisions and make new ones. And so what are some things you can ask? Well, if you're worried about how a treatment affects your quality of life, you could say, I'm concerned the treatment will impact my ability to care for my family. Or maybe if you want to have a deeper understanding of why that treatment has been selected for you and what the benefits and risks are, you can say, what are the pros and cons of this treatment you're recommending? It's important to ask those questions and not just, take it all in and then go home and have a lot of questions to ask. Like, take it all in and continue to have a dynamic conversation. And it is overwhelming. Sometimes patients are in the room and, sometimes you say the word cancer and about 20% of what you said after that is what they retain, right? People sort of stop listening and glaze over. So if you need extra time to think about things, bring it home, talk it over with your family, that's okay too. Let your team know that you want to have a little bit more time to mull things over. So how and when to discuss priorities with your team. So here are important questions to ask, right? What can I expect now? What can I expect in the future? It's really important to have these conversations, not just during treatment changes, but when your priorities and goals have changed in your life, you're starting a different treatment, new treatment. Continue to ask these questions. It's not a one-time event, right? And so here is a snapshot of some of the questions you can ask. This is our myeloma treatment discussion tool, and it was designed with patients, members of the IMF, and caregivers to have the patient in sort of the center and sort of understand what is important to communicate to yourself and to your team. So these are easy yes or no questions, right? So for example, yes or no, it's important for me to understand my treatment plan. I prefer the most aggressive approach to treat my cancer, yes or no. I'm really concerned about out-of-pocket expenses. I'm really interested in clinical trials. So these are a set of questions you can really ask yourself, even circle it, and bring it to your appointment so that your provider can really understand what your preferences are and make sure that your individualized treatment plan is really tailored for you. So additional tips for communicating with your team. Prepare yourself for each visit, right? Understand what's important to you, how effective the treatment is, how will my quality of life be affected, what are the risks, side effects, are there any alternative treatments that we can talk about? Write down your questions, bring them in, and if you don't want to do that at your visit, that's fine. Appoint an appointment secretary. Bring someone with you who's in charge of writing down everything that's said, bringing in your questions. Like I said, they're your second eyes and ears, and they can sort of ask questions that maybe you didn't think of, or hear things that maybe you didn't think of as well. Take notes, ask time to consider options, and then, continue to learn about myeloma from reputable resources. I mean, the IMF has so many resources for patients in easily digestible formats, just like Dr. Joe talked about. We have our myeloma made simple in 5 minutes and much more resources for patients. So when you start thinking about the best way to communicate with your healthcare team, start to think about some of the risk factors of myeloma, right? So as Dr. Joe said, we don't 100% understand what causes myeloma, but we do know about some risk factors and by risk factors I mean these things can increase your risk of developing myeloma. So we know that being African American increases your risk 2 to 3-fold, being male, being older, or even overweight. All these are things that can contribute to your risk of developing myeloma. And when you're getting your comprehensive lab work, ask questions about how to interpret it. Because we, as you saw in Yalek's picture, we like to draw a lot of blood. And so not all those results are really clinically significant for you. So ask us to help interpret them and show you what is the most important in those lab reports. And then make sure you talk about what's important to you and what your goals for treatment are. And I always tell my patients, nobody knows your body better than you. So if you're feeling unwell, something is bothering you, don't ignore it. Don't self-medicate it. bring it to your provider's attention. It might be something we really need to investigate and get ahead of. And if you do that, you can really avoid emergency situations, right? And also talk to your team about side effects that you're experiencing, because it could be related to the treatment or it could be related to the myeloma. Either way, if it's related to the treatment, there's many things we can do. We can dose reduce, we can try something else, we can add additional medications. So that communication is really important. So we know that myeloma can contribute to basically how you feel overall, either physically, emotionally, and even financially. So by physical symptoms, we talked about that fatigue that can be just from the myeloma itself or anemia causing the fatigue. A lot of the medications we give can cause a lot of bowel distress, constipation, or even diarrhea, pain from the bone lesions, and psychological symptoms are very real and shouldn't be forgotten about, right? Anxiety, depression, cognitive disturbances, sleep disturbances from all the steroids that we give patients, and people might notice they're having a decrease in their everyday function, which is, really affecting their quality of life. And then, as Dr. Joe talked about, we have had such amazing emerging novel therapies over the years. So myeloma patients are living much, much longer. It's becoming a chronic disease. But with that comes sort of the financial burden of treating the disease for so long, right? People can start to experience financial toxicity from the co-pays, all the office visits, transportation, et cetera, which I'm going to talk about a little bit more. So here is some GI symptom prevention and management discussion. So for example, if you're experiencing something like diarrhea, right? Talk to us, because it could be many things contributing to it. It could be laxatives, maybe you just recently took a course of antibiotics, could be some supplements that you're taking and you weren't even aware that it was causing diarrhea, or even some sugar substitutes can do it. And so we'll talk to you about increasing your hydration. Diarrhea really dries you out, gets you dehydrated, so you need to avoid things that make you even more dry, such as caffeinated beverages, sugary beverages, and we'll also prescribe antidiarrheal medication. So here's an example of you bringing symptoms to us talking through what could cause it, and then how to best approach it in management. And it's really important to discuss this with your team, because we can identify the causes and make adjustments to medications accordingly. And then, like I talked about, the emotional side effects, right? So fatigue, anxiety, and depression, all of this can affect quality of life. And although almost every patient, so 98.8% of patients experience fatigue, hardly anybody talks about it to their provider. They just think it's par for the course. I'm tired, this is the way my life's gonna be forever. But there's definitely strategies that we can help you to manage that chronic fatigue that you have. And there's a myriad of things that can be causing it. Like I said, the anemia, chronic pain, being sedentary and not moving around very much, not getting good quality sleep. There's a variety of ways that we can sort of distill down to figure out how to improve your low energy level. And we see anxiety reported in a third of patients. We see depression reported in a third of patients, and also financial concerns. So all of this is something that should be voiced to your provider, because we can help you, we can find resources, we can find psychosocial support for you so that you're not alone in this at all. So the financial burden, that's a very real toxicity, right? And it can be from medical costs, high premiums, high co-pays, travel expenses, just the cost of the medications itself. And then even loss of income is financial toxicity, right? You might have to take time off of work to attend all those appointments, or even your caregiver has to take time off his work as well. So there can be real loss of income. So talk to your team. There may be a social worker or a patient navigator or a financial counselor who can help find resources. There's lots of grants, there's loans, grants and loans. Even pharmaceutical companies can provide copay assistance and sometimes transportation assistance. So ask. And on the right side, you see we have our IMF info line, and we have other resources as well for drug expenses, travel expenses, and even for special populations such as veterans. So I gave you a lot of information, but in summary, I want you to understand that you really can change the course of your care, right? I want you to feel empowered to be an advocate, ask questions, continue to learn, give yourself permission to speak, right? Communicate what your questions are, what's important to you, what your goals of care are, and with that, you can really play a dynamic role in your care and sort of change the course of your care. And for additional resources, we have lots the IMF can provide for you. Medication pamphlets we have our television series, we have our IMF info line, many great resources for patients and caregivers to further understand myeloma and increase their knowledge. And that's it.